If the bills go forward, though, as is, you won't be faced with that situation. You as an individual would go into the health exchange, you would have your choice of health plan, Blue Cross, Kaiser, public option, whatever, and all of them would have to take you with no pre-existing conditions and no high costs. Theoretically, at least.
Okay.
That's the insurance reform piece of this, in which case you don't need a public option to solve that problem.
And the interesting thing with community health centers is we have strong bipartisan support and always have. And in fact, they have put strong funding in these bills, all the bills, to continue the community health center and actually expand that system. When suddenly they put an insurance label on it, we can't have a public option. But what we do need is to be able to strengthen that component that isn't readily available to community clinics, and that's access to specialists and access to hospitalization, which is why many community health centers around the country have banded together to start their insurance plans. And here in LA, we participate in LA Care. So there have been public options that have existed around the country, but we're kind of this hidden secret. And in a way, I think the feeling was, well, we'll make sure the clinics are taken care of. We won't call that the public option. We'll kind of ignore that, but politically we'll come out against public option, which to me is you're contradicting yourselves. And you know, whoever said about the marketing issue, I think you're absolutely right. You've got to take that public notion equaling government and somehow discuss this as the benefit for those who have not had adequate access up to now, that we need to be able to make sure that they continue to maintain or get affordable access.
Would most of you like to see, or would you think this would be a negative, to allow as a public option, community-based, maybe government-directed, but maybe not so much government-directed, health plans, because there are such things. There's a whole organization, ACAP, in Washington that has 43 member plans in 23 states, all of which are based in safety net hospitals and safety net communities. There's organizations like LA Care, San Francisco Health Plan. All of these might classify as public options. Would these be an acceptable alternative? And if so, should that be in the legislation?
I think we have a real sense of urgency, and if we can adopt whatever the plan is, and I like the community care, community clinic system, I like expanding Medicare. Neither one requires a new infrastructure to be put in place. Neither one requires a whole new system to be put in place. You could implement it very soon. When they implemented Medicare in the first place in 1966, there was great fear. 19 million seniors are all of a sudden going to be eligible for Medicare. They had helicopters out, and they were worried that the hospitals were going to be flooded. It didn't happen.
You know, I think it's important when you're looking at public option. It's almost like when you're looking at our media system here in Los Angeles, where 3 media companies own all the TV stations and radio stations. This is a drive competition. And when you're looking at public option, you have, what, 5 or 4 major insurance companies in this country that are going to dictate in this healthcare reform. This does not drive healthcare reform. It drives insurance reform. Right? Yeah, exactly. And so I think public option works. I think it's realistic, and I think it'll drive the market the way it's supposed to be driven, and it is basic, fundamental, free market system.
For most of this, it's an implementation over 18 months to 3 years. For most of the things that are in here, some things are actually, they may take up to 5, but definitely 18 months because they have to create all of this infrastructure. I do think somebody needs to make sure they understand that, because it's not clear. People think the day that the bill is signed, everybody has health care, and that's not the way it's going to happen.